The following presentation is a production of Ride the Wave Media.
It's the Best Birth Podcast, where we interview experts that elevate you as you prepare your heart and mind to have the best birth.
Each episode will interview professionals so you are prepared for pregnancy, birth, and postpartum. Our experts will build your confidence and empower you to trust your intuition throughout your pregnancy.
This audio is taken from videos on YouTube. Watch the entire episodes on YouTube at Birth Made Mindful. Thank you for tuning in this week to the Best Birth Podcast. We're excited to have Dr. Betty DeLass with us today, a pelvic floor health specialist.
Dr. Betty is the founder and owner of Reborn Pelvic Health and Wellness. She is extremely passionate about changing the standard of care before, during, and after pregnancy, because postpartum is forever. Betty is a world-class pelvic health expert and has built a center of excellence in Utah for pelvic floor physical therapy. She is a physical therapist by trade and has helped thousands of people throughout her 12-plus year career to function, feel, and move better. And knowing firsthand how difficult it can be with 2 children of her own, she wanted to help others get back to living their lives to the fullest without shame or embarrassment about their pelvic health. Unfortunately, more often than not, pelvic dysfunction can lead to postpartum mood disorders, secondary to an inability to get back to activity because of unexpected physical changes, pain, discomfort, leaking, and/or painful intimacy. What if we worked more upstream? What if we worked on preventing dysfunction from happening in the first place? And what if we provided true rehab and prehab to our birthing people? And that was where Reborn was derived. As the business continues to grow, we are adding more specialties outside of pregnancy and postpartum as Reborn recruits and retains top-notch pelvic floor physical therapists in men's and pediatric specialties. As a doctor of physical therapy, she believes one-on-one care is best. She is also passionate about finding the why behind your symptoms, optimizing your body, and empowering you to become the expert of your own body so that you can live life to the fullest. When not at work, you can find Dr. Betty hanging out with her husband, 2 daughters, and 2 fur babies, dogs. She also spends her time enjoying endurance sports like marathon training, triathlon training, lifting weights, hiking, and cross-country skiing. Welcome, Betty. That is fantastic.
Thanks for the fabulous intro.
Yes, we are excited to jump right in and talk about pelvic floor therapy. So just beginning, what is the pelvic floor?
Yeah, pelvic floor. So most people are like, pelvic floor, what's that? It's a sling of muscles that sits in between your pubic bone and your tailbone. It supports your organs. It helps with sexual function, pooping, peeing, things like that. And so if you don't know that you have a pelvic floor, that probably means it's like working well. Most people don't know they have a pelvic floor until something's wrong or dysfunctional. And they're like, this is not right. I need help. It's the area underneath where you sit on between your sit bones, pubic bone, tailbone, and like a hammock underneath there of just muscles.
And would you say pregnancy is kind of like the number one reason someone would come to you and say, hey, it's not working anymore?
Sure. I think there's a variety of reasons why people would come to see us. The business primarily started in pregnancy, postpartum, because that was what my passion was around when I went through those things. And obviously, there's many other reasons why you would need pelvic floor therapy. There's plenty of people who've never had babies that need pelvic floor therapy. Men can need pelvic floor therapy. Kids can need pelvic floor therapy, right? So we're adding those arms of the business in as we grow. But that's where the passion, that's where Reborn started, was truly like pregnant, postpartum. And if you think about it, like if you were to have a knee surgery or shoulder surgery, you would go to physical therapy before, and then you'd have your surgery, and then you would go after immediately, and you would go for months and multiple sessions. And when we grow a human inside of us, it changes multiple areas of your body, your rib cage, your core, your low back, your glutes, your pelvic floor, and all of these things change rapidly over 9 to 10 months. And then you go from being extremely pregnant to not pregnant at all, and then you have to recover from that. And so it's just this huge musculoskeletal change. And I would argue the biggest musculoskeletal change, even more so than a knee surgery or shoulder surgery, because that's like one area of your body and you can like recover and rest from it. Like your pelvic floor, you can't, like you still have to cook and pee and sit and carry, lift baby and take care of family. And like, you don't actually like truly get to like rest it. It's still being used. And so it's mind blowing to think that like we wouldn't be doing the prehab and the rehab during this time of life. And some of us do it multiple times, right? And so it's like, what are we doing? We need to do this for for our birthing people. So that's kind of like what we started out specializing in. Other areas that we help with is people who have painful intercourse or conditions like vaginismus, where the vaginal canal is tight and hard to have either a tampon in, speculum, intercourse, then baby coming out if that's the route of the problem. So there's areas with that, or like endometriosis or painful period. We can help with those things. Constipation, leaking, prolapse, diastasis recti, separation of the abdominal wall, which is primarily due to pregnancy and things like that. And then there's other facets to that too. A lot of orthopedic conditions are underlying with that. So we have like low back pain or SI joint pain or pubic bone pain, tailbone pain, anything that's there. It's often a combination of things both inside the pelvis and outside the pelvis that create issues surrounding pelvic floor things. And then you could add in the whole facet of men. This is about the best birth podcast, so we'll keep it focused on that for today.
Sounds great. How does care differ when it's a cesarean versus a vaginal birth?
Yeah, great question. So with a vaginal birth, it stretches the pelvic floor. With a cesarean birth, it's a major abdominal surgery that cuts through 7 layers in the abdomen. And so where there's differences because of the surgery that happened. So like when you have a vaginal birth, the baby still grew on top of your pelvic floor. All these other changes happen. Same thing with a C-section. Like baby still grew on top of the pelvic floor, body still changes. So you have those both things happening. When a baby comes through, it stretches your pelvic floor muscles 2 to 3 times their length, and they survive to tell a story most of the time, right? But there could be tearing or scar tissue or things like that. Prolapse might be more of a common thing, or incontinence might be more in a vaginal delivery. Where in a C-section, it depends on if they didn't push, how long did they push, like things like that. So they might have both, if depending on where that happened, or if it's like an opted-in C-section or preventative measure and they didn't push at all, then it might just be the recovery from the abdominal surgery, but on top of like being still growing inside your body. But you might not have as much like leaking or prolapse, but they're usually more pain with intercourse or symptoms of UTI-like things because of the fascia that gets stretched in the scar tissue network causes the pulling on the front half of the pelvic floor and can create symptoms like frequency, urgency, pain with intercourse, things like that. So we work on that. And that would be a generalization if I were to like categorize differently. But a lot of that can overlap, and you could have none of the C-section, you can have all those things, and vice versa. But that would be like a generalization if I could.
It feels so important, though, to mention, because a lot of people think that if you have a C-section, then you're kind of spared from some of these problems, the incontinence or the painful intercourse. And that's not the case. In some people's situation, it's actually worse if they have one or the other type of delivery. And so this is so great that you are walking us through and telling us kind of what to look out for and just to evaluate like the risk and the benefit of some of these modes of delivery.
And same thing with like, I mean, everyone knows that mom butt's a real thing. And so like when you're pregnant and postpartum, right, like butt like turns into a pancake. And so if you think about it, going back to the analogy of like the knee surgery, usually if you have a knee surgery, your quad or the front of your leg gets inhibited and it gets weaker and you have to like get that activated. Same thing happens when you grow a baby. It's your core, your glutes, the low back, your pelvic floor. So it's like multiple areas. And so we have to realize that like we do need to re-engage those muscles, get them back on activated, especially the glutes, because they're a big muscle that supports the pelvis and the cornerstone of movement there. So it's really, really important to make sure that we're like, for both types of deliveries, focusing on those things and the core on top of that, to get people back so they can, pick up their kids or give them their kids a bath or lift the Costco box into the car. And, like there's so many functional things that we need our bodies for. And if we don't rehab them, it can be detrimental to like the quality of your life.
And can we talk a little bit about the prehab? So I'm so curious, like I have had 3 babies and I have never once done any sort of prehab for my pelvic floor. Can you give us just a couple of examples of what we could be doing if we don't have access to a pelvic floor specialist?
Totally. So there's a couple things I'm going to add in there. So most people are like, oh, I'll just wait till after I have a baby, then I'll come in. And it's like, oh, well, we could do so much ahead of time. So a lot of times we can prehab and we can catch things that are either there that you don't know are there. They were subclinical before, meaning you'd had no symptoms, but we're finding them and catching them early so that we can prevent things further down the line. And so when we think prehab, like we often get people coming in before they're even like becoming sexually active, before they're wanting to get pregnant. Just like you have a preconception appointment, you would go and be like, how does everything look? How are my hormones? How is this going? Like, we do that from a musculoskeletal lens of like, how are you moving? How is your low back moving? Your hips moving? Your pelvic floor? Like, how is everything moving? Is there anything there that we can work on ahead of time to prep and get you there? We also do like fertility work as well. So from a mechanical perspective, obviously we can't change someone's hormones, but we can make the abdomen and the pelvic floor area a hospitable environment, meaning like there's no red flag, there's no virus going on, and everything feels great and moves well, has good blood flow, organs are moving well. So like we could help set up a great environment to set that up for a pregnancy. And then labor prep and delivery as well. So like we will help with hip mobility, sacral mobility, low back mobility, so baby can get into a good position. Turn babies, like we don't turn babies, but we could help set up the environment for babies to be turned, to be head down, and then also prepping for the pelvic floor to get out into late. A lot of people are like, oh, I need to do Kegels to prep my pelvic floor for delivery. And it's like, actually, you need to learn how to relax your pelvic floor so your pelvic floor can get out of the way. Your uterus is going to push your baby out. And that way, when you have a mobile pelvic floor that knows how to relax, decrease your tearing risk and things like that too. So like there's so much upstream that people just have no clue about that we can help prep from like consider it a prehab approach. Honestly, it's still rehab because we're finding stuff and working on it. People just don't know that they were there. So
that is fascinating. I have been going to physical therapy for diastasis recti, and as I was in the appointment, we uncovered all these other layers, fascia and the pelvic floor itself. I didn't realize I needed pelvic floor therapy. So do diastasis recti and pelvic floor go hand in hand, or are they really just separate things to work on and note?
Yeah, that's a great question. So from my clinical like lens and ethos, I believe that diastasis recti, and I'll even put like prolapse and incontinence and like all these conditions, they're a system problem, really. And so like you can have diastasis recti, but why do you have the diastasis recti, right? Like getting to the underlying root cause. Is it like, and some people there's a spectrum of this, right? Like some people it's like just poor genetics. Your parents gave you the genetic like code for like really elastic skin and like, sorry, you got dealt with that. But usually that's not the only case, right? And so sometimes there's tightness in the low back. And so I like to use the shirt analogy. And I don't know if people will be able to see this video or not, but like if your shirt is really bunched in the back and it's tight back here, this is not stretchable. And so what stretches is that middle part called the linea alba, and that's where that diastasis happens. But if you get this moving, then this can all stretch, and then you don't have that separation as much there. And then I know, right? Mind blown. And then same thing on like the pelvic floor. So like if your pelvic floor is really tight and you're pushing and pushing and pushing, or you have chronic constipation, the only place to go is the vaginal canal because it's open. And so that's where things go. And so if you can loosen the pelvic floor, loosen the low back, or loosen the core, and have everything in a system working well with strength, mobility, coordination, all these things like that, it ends up resolving a lot of these things or prevents those things from happening because we're looking at it from a system approach. And it's usually multifaceted, like you said, Jen. Like you're like, oh wow, I didn't know this or this or this, and it's all related. And that's, I think, some of the hardest things that we struggle with is like people are like, oh, pelvic floor, you just do Kegels and you do this and that, and then you're like, good. And it's like, whoa, whoa, whoa. And back up so much more than that. And so like more in depth of like how all of these things interplay on each other. So I don't know if that answered your question, but that's what I want to say.
And will you actually prescribe different exercises depending upon what you find, right? So for some people, like the plank is what they need to help get all of their system back in place or to prepare. And then for others, are they able to do sit-ups or other type of exercises? Is there anything that we should be avoiding during pregnancy? Any exercises?
That's a multi-loaded question there. So I'm going to dissect it a little bit. So like from an exercise standpoint, in my opinion, all exercises can be good and all exercises can be bad. It all depends on how you do it and the form you do it with and how your activation and like knowing what your body is doing. And so like here at Reboard, we really, really focus on like helping you become the expert of your own body, because you need to know how, am I activating my core right? Am I breathing right? Am I getting my pelvic floor? Do I have my glutes on? Like, how do I engage all of those things in an appropriate way, depending on the load that we're placing on it? So if we're just doing like a sit to stand, that looks different than a plank, which looks different than a deadlift, picking like a kid off the ground. or squat. Like we will break all of those down into foundational movement pattern, teach you how to do that within your own body and work on the other parts too, where like you can't get there. We might dry needle something, or we might mobilize this area, or we do some manual therapy techniques where it's like, okay, now you can get to that position. And then we reintegrate those movement patterns back in now that you have the motion to do it. And so it's all those layers of building that foundation, because honestly, people are just have poor foundations and they didn't learn like things early on, or they have bad motor patterns because of a pain or an injury or whatnot, or just gave birth, and like you get dysfunctional there. And so we recorrect all those things, and then you get to lead being the expert of your body, knowing how to do all those things. And so back to that original question of like good, bad, it's like it totally depends, right? On like how are you doing it, and do you have the mobility and motor awareness to do it properly? So we work a lot on.
In talking about how all these systems are related, can doing physical therapy on your pelvic floor improve your energy, and how does that translate to other areas of your life?
Yeah, great question. I mean, I full 100% believe the yes. Like we're here to change the world one vagina at a time is what I like to say. So, it goes back to like, if you can function and move in your body confidently, well, and without pain and dysfunction, you're able to put that energy somewhere else. So like whether that's to your family, to a workout, to cooking healthy meals, to going on, it ripples out into the community, you name it. And so if you're able to work on those things, your energy is going to be better. You're going to sleep better. You're going to work out, like ripples into all of these other wonderful health and wellness benefits that you then want to do. But if you're in pain or you can't have sex because it's uncomfortable, that can be detrimental to your relationship. It can cause, other emotional things. Like, so it can spiral the other way too when you don't have this where it needs to be.
I'm thinking about my own stomach, my own core right here. And I'm thinking like, what do I need to do? I feel like I've had that separation in my abs for a while since I've had those 3 babies, and just trying to put it all together.
Yeah. Can you walk us through a first appointment? I remember when I started to get pelvic floor physical therapy, I wasn't sure what to expect, but I knew I was motivated to get the help I needed because my pain had gotten bad. I still didn't know what to expect. So I think it would be helpful to walk someone through that.
Totally. So when you come in for an evaluation ahead of time for us, and I'm speaking to what we do here, it might be different other places, but you will fill out all your online paperwork ahead of time. So we get a very robust medical history on you, all the TMI questions of pooping, feed, sex, babies, deliveries, all things. We want to know all that ahead of time. So that when you come in, we ask some clarifying questions, go over your story a little bit, and then we dive right into assessing and looking at you. So we like to tell people we do a full body evaluation in the sense we are PTs, we're orthopedic PTs, and we're pelvic PTs. So we're like the nerdest nerds of nerds, and we're going to do it all because it's all connected. And most of the time it's inside the pelvis and also the pelvis, and you need to be able to do both. So we'll have you move all different directions, maybe squat, balance, lunge, jump, run, depending on where you're at and if that's appropriate or not at the time. And then we'll dive deep into each area of your body. So we'll look at your we'll look at your entire spine, your rib cage, your breathing patterns, your abdominal muscles, where are they at? Diastasis recti, we'll check visceral mobilization, which is how do your organs move. So just like your joints move, your organs move on top of them too. Sometimes we forget that we have things inside of us. So we want to make sure those are moving well on top of each other. Especially with pregnancy, postpartum, scar tissue, C-sections, like that can be disrupted. We'll check that. We'll look at your low back, your SI, your tailbone, pubic bone, all the way down to your feet. So that's all external first. Then we switch gears and do an internal exam. And most people are like, whoa, internal exam. What do you mean by that? It's similar to an OB or midwife in the sense that it's an internal pelvic exam. It's different in the sense that we have no speculum, no stirrup. It's just glove, lube, one finger, and we're assessing through the lens of a PT. So we're looking just like we would at any other muscles in the body and musculoskeletal system of range of motion, strength, coordination, trigger points, scar tissue, pressure management, endurance. Like how are all these things working functionally? And then taking what we find internal and external, we combine that together for individual needs of like you and why are you leaking, or why do you have pain with sex, or why do you have prolapse, or why for you, and then make that very individualized to treat what we find so that you can get back to doing the things you want to do and not even think about your pelvic floor again.
That's fantastic. And I've been working with one of your PTs, and I love how you have homework every time and it's really spelled out and easy to follow the plans. And I've had a very positive experience at Reborn. So I'm so grateful for what you do for the community. It's fantastic.
And I think it's so important to know, like, once you have a baby, it doesn't just mean that you'll be peeing your pants for the rest of your life, that you'll never be able to jump on a trampoline. And so knowing that this is the resource that we need so that if we have any of those circumstances, we'll be able to get help. A question to ask you, would you say that this affects like kind of 100% of women who are pregnant? Is there anybody who walks away from pregnancy and just doesn't have any pelvic floor dysfunction or problems or separation?
Yeah, that's a great question. I'm sure those unicorns are out there. We don't see them, right? Like when they don't come to see us usually. And so I'm sure there's some people that are totally great and fine. But most of the time I walk around with a lens of that every single person I meet, even just walking down the street, has pelvic floor dysfunction, whether they know it or not, until proven otherwise. So there's usually something going on, right? We are moving, walking human beings. You can't tell me at any point in time you've never had pain or you've never had low back pain or you've never had this or like, so there's something there and your body is resilient. Your body wants to heal. It wants to be in an optimal state. So it knows how to heal. Sometimes it just doesn't heal correctly. And that's where we come in to like help facilitate that and get you on the path to full healing. But your body does want to heal. So, that being said, it's like, oh, wow. Like you could like think that there's nothing wrong, right? Like your example, Jen, of like, well, I thought I was just coming in for this. And then I was like, oh, wow, these are all related. And I had no idea. And so a lot of it's just educating patients on how everything is connected. And there's also an amazing stat, but not so amazing the way, depending on how you look at it, is 97% of people with low back pain have pelvic floor dysfunction. So it's like, yep, almost everyone.
Wow. What I've learned is my pelvic floor was tight. And so we've done a lot of needling and movements to get it to relax. And that seems to be a pattern in my body is tight muscles. But it's been interesting and great to learn too correct postures and how to retrain your body for times that it's overcompensated or learned incorrectly. Because as you said, our bodies are resilient. They figure it out, but do they figure it out correctly? So I love that you can guide us in that path there.
I have a quick question about belly binding. So after birth, a lot of times we're told that we need to get those organs back in place. We need to help them find their form again. Mm-hmm. What would you recommend for belly binding after birth?
Yeah, I'm gonna give a spectrum on that. So there's the camp of like everyone needs to belly bind, and there's the camp of like no, absolutely not. And I would say I'm in a true PT style. It depends. So it depends on like the person and the individual. Like, are we binding from an aesthetics reason? Are we binding too tight? Are we binding for a cultural reason and for closing of the bones and like. So like there's appropriate times and places to do those things and it can be appropriately done. I personally did a little bit of belly binding when I did my core exercise. So I wanted that proprioceptive feedback of bracing on there for my core to be like, okay, yep, I got that. And then as soon as I didn't need it, I got rid of it. So there's a time and a place for each individual person, depending on what the surrounding environment is around that. So the only thing I would caution people to is like, don't do it too tightly and like cinch it all in because your pelvic floor is very, especially if it's been a vaginal delivery, has been stretched out and prolapsed and things like that. So those like squishy toys where you like squeeze them and the like poop comes out, right? It's like that. You're basically like doing that to yourself if you're just like cinching things up and it's just putting so much pressure down on the pelvic floor that it can exacerbate prolapse and things like that. So I caution people with like the extreme. But I think it's a beautiful thing to do, like the closing of the bone ceremony and like things like that. So like, yes and no, depends.
Well, and like you said, because our bodies are so resilient, there is a time after birth that everything is, tightening up and the organs are finding their place again. And so my question, I think, was wondering if we have kind of like a pocket, a window of time in which we really need to capture so that all of our organs and our pelvic floor can kind of revert back to, like that pre-pregnancy normality.
Yeah. There's no research on any of that stuff of like what it should be or shouldn't be, or is there a time window? We do know that like with pregnancy and postpartum, that if you're breastfeeding, it drops your estrogen and that helps kind of stiffen your tissue. So there is a positive to that breastfeeding and estrogen drop to stiffen the laxity tissues. So it is protective in that sense. And then as soon as you stop breastfeeding, estrogen goes back up and then it increases laxity a little bit. So there's a little bit of evidence on like that stuff. But other than that, I personally, and more again, from a preventative measures, like if you can come during pregnancy and anywhere 2 to 4 weeks postpartum to like start working on these things, you set yourself up for success. And so our clients and patients that come in and do the work pregnancy and then postpartum right away, we're in the best position in the sense that like we're often holding people back because they feel so great. We're like, well, you still need to respect tissue healing timelines. Like that doesn't change. That is like very reliable, measurable, and like research. So like you're doing well, but don't do too much, right? And versus like the other way around when people don't do anything and they're, waving the red flag and they're like, help, please help, I'm in so much pain. We're not holding those people back. We're just trying to get them back to wherever they want to go. So that's a little bit of like the perspective on that.
Speaking to that, I was in the camp of, oh, I have diastasis recti. I'm going to ignore this area out of caution to just let it do its thing. And that ended up being inhibitory because I ignored it. And so it wasn't moving. It wasn't getting all of that flow back in. So we look at that landmark of 6 weeks after pregnancy, our checkup. And what would you say if a woman is there at that stage right now where she's had her 6-week checkup? What would you encourage her to do to move that area and get it going again?
Yeah. So I'm going to touch on one thing before I answer that. So the 6-week postpartum checkup is for OBs and midwives from an infection healing standpoint of the uterus, not for movement, because you go home from the hospital, you have to carry that baby, you have to lift that baby, you have to put the baby in the crib, car seat, all of it. So it's like, we should start that in the hospital or at home or ahead of time. So rehab starts before 6 weeks and goes well after 6 weeks. The 6-week mark is really from a tissue healing, uterine healing, infection risk. And so that's that piece. And then from if someone's coming in around that time, anywhere newly postpartum in there, we focus a lot on just connecting back with breath, getting a rib cage to come back and down, core online, glutes online, pelvic floor, connection of all those things, not max contractions or like 1 rep max or anything like that. It's just, can we connect everything back with our breath? Can we get our body in a safe spot? Can we engage things in appropriate load? And then as each patient is able to kind of like almost like a checkbox list of like, okay, now you can do this, then we move on to this. So that timeline can be very variable for some people. So like some people are back to running at 6 weeks postpartum. Some people are not even close until like 2 years postpartum. It just really depends on like where they at and what were they doing and what were they doing before. So we have kind of a protocol checklist of like, we're looking at these certain things. Can you do these things? Like, can you do a single leg sit and stand with good glute control and good knee control? And can you do a jumping without any prolapse or incontinence before we never start someone running? So we're working through those checklists to make sure like, okay, yep, you can do this. Now you can move on to this. Yep, you can do this. Now you can move on to this. But if someone's at this threshold and they just can't get past it, well, they have to stay there in that work zone. We're like, well, you got to work here for a little bit until you get strong or stable enough or your tissue is ready for that load. And then we can progress on.
And thank you for clarifying that 6 week, because a lot of times we're looking at that as a landmark. We're looking at that as total healing and back to normal. And it's just not the case. We should be doing things before and afterwards, helping our bodies.
That's honestly what made me, what I like to say, righteously angry when I had my first child is I was like, okay, I'm a PT. I know what to do. I'm doing all the things. And like at 6 weeks was supposed to be this like magical, okay, you can go back to sex, you can go back to working out, you can do, and I got to 6 weeks and I was like, who in their crazy mind thinks that this is an appropriate time for it to do any of these things? So I think it's important to know that like 6 weeks is not magical. It is like, yes, your uterus is healed and that's about it. There's plenty of people who like way after that are not ready to have intercourse. They're not ready to be even lifting weights or anything. Like we have to make sure that we're individualizing that care to everyone and not blanket stating like, oh, in 6 weeks, you're good to go. Everything's right. It's just a huge disservice. We would never do that again. Going back to my original analogy, we never tell someone with an ACL repair, oh, in 6 weeks, we're good. Rotate a cup for go ahead. Everything's great. But it doesn't make sense. Right. So.
Yes. Thank you so much for your conversation today. It's been so informative. Every week we share a Mom Squad secret along the topic of today's episode. So we will share from Jean. She says, Even if you pee when you sneeze or cough, keep doing glute bridges, zipper hips, and deep pelvic floor core exercises. They do, in fact, help with delivery and recovery. What would you say to that?
I think she's on the right path for sure.
We also love to share any resources that you might have to help our moms in this specific topic. Do you have any books, any podcasts, any other experts, or any, personal things that you would recommend?
Yeah. Well, if I can toot our own horn, we do have a website that you can go to that has a bunch of free resources. So it's just www.rebornphw.com. We have free resources on there. We also have an app and a membership that people can do if they're not local to us to come see us. A website where you could find someone local to you is called pelvicrehab.com. And then that way you can just put in your zip code and see who's close to you. And then as far as other resources, I feel like Instagram has exploded with like pelvic health. And so there's a lot of good ones out there. I would caution people to make sure that you're following someone who is a pelvic floor PT or an OT that actually has the expertise, because there are people out there in the influencer world that are saying they are experts in this when they really are not. And we see things and I have to put blinders on and be like, okay, no, pay attention to that. So I would just make sure you are a educated, cautious consumer of what you're ingesting, and know that you're following quality people that have the credentialing behind them to be saying things that they're saying. But other than that, then there's a ton out there. I think a couple books that are good to read just in general is Come As You Are, and then The Body Keeps the Score. Those are two really profound books that we recommend a lot to our patients to really help through their healing process and their journey to health and wellness.
I love that book, The Body Keeps the Score. We'll definitely link to that in our show notes and the other resources that you provided today. Dr. Betty, this has been a fantastic conversation. Thank you for giving us your time and your expertise. We really appreciate this conversation today.
Absolutely.
Thanks for joining us on today's episode. We hope you've been elevated and inspired by this week's expert.
Subscribe today so you never miss an episode. And please share our podcast or post on your social media so that other moms and dads-to-be can also have the best birth.
Please note that the information provided is based on the expert's insights and personal experience. It is not intended as medical guidance. Please seek the advice of your medical provider as it applies to your specific condition.